Hi, this is John Kanellopoulos from our office here in Athens, Greece, the Laser Vision Ambulatory Surgery Center. Very exciting to show you our award-winning video in practice just 2 weeks ago. This is a patient with PBK. He already has a Barveld valve in his left eye. We can see it here, done in Australia. He's a Greek Australian. He's in Athens now. He has significant cornea edema. We're going to see here his cornea. We can see the epithelial edema, microcystic edema. Cornea thickness is at 640 with the Avanti as your segment OCT, and we can see how fuzzy the fundus looks, as well as the significant cupping in his left eye. So we have the quite difficult decision whether we're going to do a penetrating keratoplasty or a endothelial keratoplasty or Descemet procedure. The problem with the valve is that the air or gas needed to fixate the graft will go through the valve and probably create problems. This is a 2.0 nylon suture, and we've presented a video of this cut quite short, 3 millimeters, and we're using the low temp cautery here to create a bulb at the end of this little piece of 2.0 nylon suture, and we're going to use it as a cork. Please don't laugh. We have created paracentesis here in the position that we would like for the Descemet procedure. I'm going to use a 0.12 forceps, as you saw there, to fixate the tube ending from the Barveld valve, and I'm inserting the cork into the tube opening. It's a little tricky. We probably need a special instrument for this. So the tip of the cork is within the tube, and I'm going to come in with a Sinski. So great to have met and worked with Dr. Bob Sinski, and the invaluable use of this tool ever since my residency years. So we've snugly obstructed the tube temporarily, and in my opinion and in my experience, this really beats tying the tube, taking the tube out, repositioning it. We're seeing here the Busen spoon, my friend Massimo's contribution to Descemet. We're folding the endothelial graft, which was sent to us by CorneaGen in Seattle, and I personally want to thank Bernie Eliakis for facilitating this in this particular patient at a time where, with coronavirus being at its peak, we're having a shortage of cornea tissue, and this tissue has traveled all the way from Seattle to Athens. So we have our tissue ready. We're seeing nothing really of interest here besides the fact that we corked the Barveld, and the same thing will hold for an AMID, which is probably more popular for us in my experience in the US and Europe. They tend to have the same tube lumen, so the same suture will hold true for AMID valve, which was the original actual video we had presented at won first prize at the ASCRS meeting in 2018 in Washington, D.C. So here we're unfolding the Descemet graft. Again, this was a pre-cut graft sent to us. We trimmed it to 8 millimeter diameter. I'm not letting my edge go before I bubble the anterior chamber under the graft, because I'm afraid it may fly out from the continued irrigation that we're seeing here on the right hand of our screen. So very tricky. I want to enter under the graft, make sure that the air bubble is on the graft. I'm securing that. I'm done on rotating the handle of a Wexel to center the Descemet graft into the optimal position. We're seeing no problem with the air. There's no escape of the air through the Barveld valve tube and under the bleb that the valve creates. This is the patient second day post-op. We can see how nicely the Descemet graft has is centered, has taken place, and we see our little cork there, which of course after a few days, we waited 6 days. The pressure of course started to peak up. This is now cornea thickness of 480 something, but with a 100 micron graft. So we're seeing that the cornea has started its deturgescence journey. We've reported on the epithelial remodeling after Descemet as evaluated by the OptiView Avanti anterior segment OCT. And here I'm picking up the tube 6 days later to complete our combined procedure. I'd rather have said I picked up the cork from the tube opening. I'm placing a mattress 10 nylon suture to make sure that everything's in place. The days that passed gives me security that the Descemet graft is steady in place. We can see now the tube opening is open. The pressure readily dropped from 22 to the steady pressure of 12 that the patient had with a drop of Ganford at night. A perfect result. A little bit sidestepping here, but I think definitely worth a while to be able to perform a Descemet procedure without any problem from the functioning glaucoma tube implant. I hope you found this presentation interesting. This is John Kanellopoulos signing out. Thanks so much for your attention.